If you are looking this morning to lose weight, the first thing is you're not alone. The second thing is this might be the very thing to motivate you to give our next guest a call. Dr. Timothy deRoos is here from Infinite Health Centers in Cleveland. Nice to see you.
Nice to see you, Julie.
What am I holding?
Well, you're holding 5 pounds of vinyl, but it's a model of 5 pounds of typical white fat.
This is 5 pounds.
It is.
You were telling me before the interview started that in our bodies, as opposed to having just a glob of fat like this 5 pounds of fat gets dispersed of evenly all throughout our body.
Kind of like marbled meat if you were to have hamburger or steak that was marbled.
Okay, which is why I think what you're going to share with us this morning is so interesting, because at Infinite Health Centers, what you're doing is you're customizing not really a diet plan, but kind of a lifestyle plan.
Absolutely.
For each person who comes your way.
Absolutely.
Explain the philosophy behind it.
Well, we've had the benefit for decades now to watch how weight loss in a healthy manner has been prescribed, so to speak, or recommended. And what we've seen is it started years ago with willpower, which always fails us, right?
Right.
Then we moved to drastically cutting calories. And we've seen people that have come in and they've said, we've been on a 500-calorie diet per day, a 1,500-calorie diet per day. We're going to the gym 3, 4, 5 days a week, but we're either staying the same in terms of the number on the scale, or we're going up. My very first patient years ago, that's what she told me. She said, I'm going to the gym doing what I'm supposed to be doing, what I've heard to do, but the numbers are going up the scale, and I'm very frustrated. Okay,
so real quickly, let me kind of help you jump in a little bit here. What you do at Infinite Health Centers, you do have some things that you believe in that you think can aid somebody on their journey.
Absolutely.
But you are not saying, here, eat these foods that I'm selling you.
Absolutely.
You're sort of teaching people how to eat the foods that are best for their individual body to speed up that metabolism.
Yeah, correct. The metabolism of the body is going to draw off of 2 fuel sources. One is going to be sugar-based, one will be fat-based. And even if we deplete all of our sugar stores in our liver, our body will next, if it's a sugar burner, it'll source muscle, because muscle stores glycogen, which is a form of sugar, and it'll draw it out of that and break that down, leaving fat alone. So our goal is to transfer that individual from a glycolytic or a sugar-burning metabolism to a ketogenic or a fat-burning metabolism.
So are some people not naturally sugar burners? Are some people naturally a ketogenic burner?
Well, you know what I see? I typically see, in part of our paperwork for new patients, the intake paperwork, we ask specific questions, and it guides us toward diagnostic questioning. And part of it is we ask patients to review their weight history through the last several years of their life. And almost 90% of the time, patients will say they were at a very lean place. So I knew they used to be a fat burner, but something happens in our lives to convert us to a sugar burner. And the more sugar we burn, the more we crave those kinds of foods. You
would probably be able to give me a number, but I would guess that most people watching have tried a diet. What's the typical thing for most Americans? 4 or 5 times in their...
At least. Some say, 2 to 3, some say 4 to 5, absolutely.
Okay. Tennessee is #1 in obesity for children.
Children ages 10 to 17.
#6 for adults.
6 for adults.
So this is a chronic problem that we have, and sometimes we set ourselves up in this effort to eat healthy because we have eliminated fats from our diet, and that causes a problem.
That's the history I was referring to, yes. The thing about our bodies is our brains in particular are 3/4 fat in the form of cholesterol. Every cell of your body has fat in the membrane. So fat is a good thing. It just needs to be a good source of fat, not something that's been damaged by heat.
Are they afraid to take this step? Because they can come in and talk with you for free. There's no cost, there's no obligation. But do some people not then see it through because they think, well, I don't want to give up the good tasting foods I enjoy?
Oh, absolutely.
But do you have to give up the good taste?
Not necessarily. There are always, we always have our go-to comfort foods, and that's part of this as well. 86% of the people who are obese have some type of emotional eating disorder. And that could be binging, that could be eating more than they had planned on, that could be comfort foods, eating when they're feeling depressed or to numb their feelings. I hear that all the time.
We were having a conversation this morning, not to get off on psychiatry, but we were talking about mental health in this country, which is a problem we all know is there. When you are not living a healthy life, when you're not even giving your body the right fuel it needs, forget weight, just fuel, does that then lead, do you find, into depression and other issues as well?
It does, because you almost can't help but have chemical changes in your brain with all the chemicals we're bombarded with. We live in a very estrogen-dominant society in terms of our food choices because of some of the chemicals used to grow our food.
So this is 5 pounds of fat that would be dispersed throughout your body. You can imagine if it was multiplied.
Place it on your knees. See the weight, you feel the weight, and some people have 6 of those to lose. You can imagine what it does to their knees.
And you said real quickly that this then leads to other issues like predispositions to cancer, diabetes, heart disease
especially.
So let me tell you where you can find him. It's Infinite Health Centers on Sunset Drive in Cleveland.
Yes, ma'am.
He would really like to talk to you. So the phone number is 423-813-7575. Again, to come in and meet with him about 45 minutes to an hour. No cost. There's no obligation, but you'll walk away knowing a whole lot more.
You will learn something.
If you do want the website just for kicks, it's called losethefatsplural.com. Dr. deRoos, thank you so much.
Thank you, Julie.
Back after this.